This is the inguinal ligament. It is formed by the appendices of external oblique abdominis muscle. The lateral end attached with the anterior superior iliac spine, and medial end attached with the pubic tubercle, and below the inguinal ligament, following structure is passes. From medial to lateral, at first the femoral canal, then the femoral vein, femoral artery, and femoral nerve, and the lateral cutaneous nerve of the thigh near the anterior superior iliac spine. And three muscle is passed from lateral to medial: iliaca, psoas major, and pectineus muscle. The artery is related with the hip bone. This is the superior gluteal artery passed through the gastrosciatic foramen, and this is the inferior gluteal artery passes through the gastrosciatic foramen below the piriformis muscle, and there is obturator artery which passes through the obturator canal, and femoral artery is the continuation of external iliac artery at the midpoint of the inguinal ligament. Following nerves are related with the hip bone: the obturator canal, obturator nerve, the femoral nerve, and accessory obturator nerve also passes below the attachment of the inguinal ligament. Lateral cutaneous nerve also passes below the inguinal ligament. And this is the sciatic nerve, arises from lumbosacral plexus, and they leave the abdominal cavity through the gastrosciatic foramen. So this is the gastrosciatic notch, is converted into the foramen by the sacrotuberous and sacrospinous ligament, and there is also the superior gluteal nerves, and here is also inferior gluteal nerves. This is pudendal nerve, arises from the sacral plexus, and it's leave the abdominal cavity through the gastrosciatic foramen, and then it's related with ischial spine. Then it's again entered the perineal region by lesosciatic foramen and entered the pudendal canal and give branches. From posterior to anterior, following branches are inferior rectal nerve, supply the external anal sphincter. The perineal nerve supply the muscles of the perineum. The dorsal nerve of the penis or clitoris supply its sensory nerve, supply the glans penis or clitoris. Muscle attachment: the iliac muscle, it inserted into the lesser trochanter of the femur, causes flexion of the hip joint. Tensor fasciculata, and it is inserted into the iliotibial tract, and which is inserted into the anterior aspect of the lateral tibial condyle. Anterior superior iliac spine is attached to attachment, one ligament, one muscle, sartorius, and lateral end of the inguinal ligament. This muscle is inserted into the medial aspect of the upper tibia, and it causes two flexions of the hip joint, flexions of the knee joint. Gluteus minimus, it present in between inferior and anterior gluteal line. It is inserted into the anterior surface of the gator trochanter of the femur, and it causes abduction and medial rotation of the femur. The gluteus medius, it is present in between anterior posterior gluteal line, and it's inserted into the lateral surface of the gator trochanter of the femur, and it causes abduction of the thigh and medially rotation. Gluteus maximus is inserted into the gluteal tuberosity of the femur, and it causes extension and lateral rotation of the hip. So in the most of the muscular attachment of the hip bone are origin of the muscle. Only remember the external oblique muscle of the abdomen. It is inserted here. This is the origin of the internal oblique muscle. This is latissimus dorsi. This is gluteus maximus, medius, minimus, piriformis muscle. The anterior inferior iliac spine is attached with the straight head of the rectus abdominis muscle, and the body of the ilium, the reflected head of the rectus abdominis muscle. The ischial spine, gemellus superior, inferior, and this is the pectineus muscle, pyramidal muscle, the adductor longus, gracilis, adductor brevis, adductor magnus, obturator externus, the quadratus femoris, the semimembranosus and semitendinosus, and long head of the biceps. This is iliac fossa, iliac muscle, transversus abdominis, quadratus lumborum, and erector spinae. The psoas minors is inserted here. The levator any attachment, one attachment site in the pelvic surface of the body of the pubis, another attachment site is the ischial spine. Coccygeus, obturator internus, the sphincter urethrae, and superficial transverse perineal muscles. This is the piriformis muscle, and this is the insertion. Gemellus superior, semitendinosus, adductor magnus. So this is the ischial tuberosity. It's divided into two parts, the upper part and lower part. The upper part again divided into a oblique line. The lateral part is attachment of the semimembranosus, and medial part is attached with the long head of the biceps and semitendinosus. Adductor brevis, adductor longus, gracilis, obturator externus, rectus femoris, iliacus. Muscle summary: tensor fasciolata, sartorius, gluteus medius, gluteus minimus, gluteus maximus, piriformis, superior gemellus, semitendinosus, biceps femoris, semimembranosus, quadratus femoris, adductor magnus, adductor brevis, adductor longus, obturator externus, rectus femoris, iliacus. Summary of the muscular attachment: gluteal surface, gluteus minimus, medius, maximus, pectineus muscle, rectus abdominis, pyramidalis, adductor longus, gracilis, adductor brevis, adductor magnus, semimembranosus, quadratus femoris, biceps, and semitendinosus. Muscular attachment of the iliac crest: sartorius, from outside to inside, tensor fasciolata, external oblique abdominis, internal oblique abdominis, transversus abdominis, latissimus dorsi, quadratus lumborum, gluteus maximus, erector spinae. Important questions: